Good day, everyone. I will be presenting to you all one endocrine pancreas disorder. The pancreas produces endocrine hormones and pancreatic digestive enzymes. The hormone function is called the endocrine pancreas. Before discussing one specific disorder, here are the common endocrine pancreas disorders. First is the diabetes mellitus, gestational diabetes, pre-diabetes, type 1 and type 2 diabetes, insulinoma, and hypoglycemia. I will be focusing more on diabetes mellitus. So diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. The hormone insulin moves sugar from the blood into the cells to be stored or used for energy. With diabetes, a person's body either doesn't make enough insulin or can't effectively use the insulin it does make. Diabetes occurs in one of the following situations. First, the pancreas produces little insulin or no insulin at all. Insulin is not a naturally occurring hormone produced by the beta cells of the pancreas, which helps the body use sugar for energy. Second, the pancreas makes insulin but the insulin made doesn't work as it should. The condition is called insulin resistance. The causes of diabetes can be further and separately explained since diabetes has two main types, the type 1 and type 2. Type 1 occurs because the insulin-producing cells of the pancreas are damaged. For some reason, the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. This causes the pancreas make little or no insulin. Sugar can't get into the body cell for use as energy. Type 1 is the most common form of diabetes in people who are under the age of 30, but it can actually occur at any age. On the other hand, type 2 diabetes stems from a combination of genetics and lifestyle factors. Being overweight or obese increases your risk too. Carrying extra weight, especially in the belly, makes the cells more resistant to the effects of insulin on the blood sugar. The pancreas do make insulin, but it either doesn't provide enough or the insulin doesn't work properly. Mellitus diabetes risk factors. Although causes of diabetes are not yet known, the following risk factors may increase your chance of getting diabetes. First is the family history of diabetes or a personal history of the gestational diabetes. Gestational diabetes is the result of hormonal changes during pregnancy. Second is ethnic background. As what I've already mentioned earlier, diabetes can stem from genetics and lifestyle factors. Third is injury to the pancreas. Injuries such as infections, tumor, surgery, or accident. Fourth is autoimmune disease. Remember, type 1 diabetes is an autoimmune disease. Fifth risk factor is age. Risk increases while age increases too, although not necessarily it increases because diabetes can occur at any age. But risk factors do really increase with the age. 6 is physical stress such as surgery or illness. 7th, high blood pressure. Next, the abnormal blood cholesterol, smoking, and lastly, being overweight. A person with diabetes may display the following symptoms: increased thirst, increased hunger, especially even after eating, dry mouth, frequent urination, unexplained weight loss, weak and tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing of sores or cuts, dry and itchy skin, and frequent urinary tract infections. So how is it diagnosed? Diabetes is diagnosed with fasting sugar blood test or with A1C blood test, also known as glycated hemoglobin test. A fasting blood sugar test is performed after a person had nothing to eat or drink for at least 8 hours. Diabetes is diagnosed by one of the following. First, blood sugar level is equal to or greater than 126 milligrams per deciliter or 7 millimoles per liter. Second, you have two random blood sugar tests, which is over 200 milligrams per deciliter or 11.1 millimoles per liter. Third, if you have oral glucose tolerance test with results lower 200 milligrams per deciliter or 11.1 millimoles per liter. And lastly, if your A1C test is greater than 6.5% on 2 separate days. How can diabetes be treated? Main treatment of diabetes is insulin therapy. People with type 1 diabetes require multiple insulin injections each day to maintain safe insulin levels. Insulin is often required to treat type 2 diabetes as well. Insulin is delivered through a small tube that is placed under the skin. Next treatment is the oral medications. Sometimes blood sugar levels remain high in people with type 2 diabetes even though they eat in a healthy manner and exercise. When this happens, medication taken in pill form may be prescribed. This improves the effectiveness of the body's natural insulin, reduce blood sugar production, increase insulin production, and inhibit blood sugar absorption. Here are some types of drug that a diabetic person do take. The glucagon-like peptides, meglitinides, sulfonylureas, and DPP-4 inhibitors. Diabetes up until the present has no cure, type 1 or type 2, and still continue to affect millions of lives. However, researchers and medical practitioners across the world also continue to study about this disease to improve its treatment and eventually cure people with diabetes. Researcher Douglas Sobel, MD of Washington, D.C., proposed the development of a macrocell islet encapsulation device to cure diabetes. Islet transplantation is a promising approach to cure type 1 diabetes and some people with type 2 as well. But current treatment requires high-dose toxic systematic immunotherapy to prevent rejection. Over the last year, Dr. Sobel's lab has made much progress to overcome major obstacles that have prevented this theory. They have synthesized a new PLJ microsphere system able to release 3 important drugs to prevent islet rejection over a very long period of time, characterize the physical properties of the microsphere system, and by doing this, have made a headway to determine the optimal drug doses within the PLGA. To achieve their goal to safely inhibit rejection of islet transplantation, they will explore an important potential local immunotherapy drug etanercept, fully determine the optimal doses for the drug-enabled PLGA, and assess the proper doses to prevent toxicity to the transplanted insulin-producing cells and a diabetic mice in order to cure them of the diabetes without injection of the new insulin-producing cells.